for you. He made it a point to say you.
I'm being nice. I'm giving credit where credit is due. What? Because the way you said it, it was generic, and I wanted to make sure that you knew I had nothing to do with it.
Credit for the majority of the vote.
I had nothing to do with it.
We live?
Yeah, the question is how's my audio gonna work?
Don't miss this show. Liberty Mutual Insurance presents.
Experimenting, man. I feel like an audio tech guy.
No, you're fine. I think I need to get like a service provider.
My cousin's an audio technician for ESPN. He's not a technician, he runs a company. My cousin, Steve Sorial, who blew out his ACL, does audio for ESPN in Bristol. We should ask him how to do this.
Well, no, I think I'm good. Look, I'm getting the yellow and the green dots. Last week I had nothing but red on my audio mixer, so I'm making progress.
Hey, can you do music? Metallica.
Oh, Guns N' Roses?
Enter Sandman.
And Guns N' Roses.
Guns N' Roses. Which
What's the
Sweet Child of Mine.
Sweet Child of Mine.
Paradise City.
Metallica, Guns N' Roses. 2 songs for Guns N' Roses, Paradise City, and then the other.
Sweet Child of Mine.
Sweet Child of Mine.
What something going on with them while we?
No.
Orthopedic surgeon and medical director of
Shit, we're on.
Sports Medicine and
Gotta put my ears in.
Questions ready and call 855-787.
And pull out the flag. I can't hear anything. Are you ready? Good.
See, this is where Facebook Live works great because you can see him fumbling around like, hey, the show's about to start. Let me know when you want to actually start.
Yeah.
Well, now it's the listeners because they now know.
They now know.
Good Saturday morning, everyone, and welcome to Inside Sports Medicine Live episode 696. 696, that means 4 more, well, 3 more technically, before we hit live episode number 700. Wow, phone's already lit up. This is your sports medicine current event show where the topics are ripped right off of the sports desk. Over the next 2 hours, yes, I said 2 hours, you're going to be informed, entertained, and hopefully learn something new. You will have the opportunity to call in or text in your questions. The phone number is 855-787-1033. The text number is 21,000. Start off with the letters ESPN. Those texts will come directly to us. We are live on Facebook. I hope. Not only can you see us, but hopefully you can hear us as well. On the other side of the glass, Saad and Taylor are here. On this side of the glass, Dr. Mayer, Dr. Ballard, and myself. So much to get to this morning.
The big 3.
Well, yep, the 3. What was that?
Is that an audio mix?
That was feedback.
I'm gonna go with the big 3.
The big 3. Nah.
Yeah, that's like the the trend in basketball. You gotta have at least 3.
Sure.
I'm gonna go with the big 3.
I'm good with that. So the question of the day, hopefully you guys can respond either on Facebook or on the text machine. 21,000-21000. Start off with the 4 letters ESPN. The question of the day, and I'm going to say that this actually came from my dear wife, Karen.
Karen.
Yep. And she said, we were sitting there watching the hockey game, and she said, what sport do you think requires the most natural talent? And I kind of scratched my head, and I was thinking about it. We're going to talk about this for the entire 2 hours, because we all have different opinions, and I'm certain that you guys out there also have different opinions. And I'm not sure that there's a right or wrong answer. I don't think there's a right or wrong answer. But what sport requires the most natural ability?
I think it's a brilliant question.
It is a brilliant question. I mean, I've never been asked that before, and we were casually sitting there watching the hockey game. By the way, I'm a hockey fan during the playoffs.
I was about to say, I didn't know when you said you were watching hockey.
During the playoffs, I'm a hockey fan, big time. Anyway, so text us your questions, text us your thoughts, 21,000. if Dr. Mayer's unusually quiet this morning, it's because he is running the electronics.
I'm trying to figure this thing out.
He is the on-site audio-visual expert this morning for Facebook Live and the audio. For
Yeah,
Facebook
sorry about
Live.
that feedback thing. That had been this new mixer.
Have you figured it out?
Oh no, we're good.
Oh, we're good.
I
Has
just
anyone
can't figure out the
responded?
delay part.
Yeah. Well, that being said, our intro is behind us now. We're going to go to the phones right after the break. So I want to go to Don right after the break. Obviously, he's been saving his question all week. So we're going to go to Don from Garland right away. And while we're on the phones, 855-787-1033. This is Inside Sports Medicine. I am Dr. T.O. Sorial, coming right back. Yeah, so this is the trick right here. Are we on now?
Yes. Oh, you mean on live?
Yeah.
Good morning. I'm
Yeah,
Saul Houston
yeah.
with the Sports Center update.
You
The
are.
Dallas
See,
Stars
I don't
I just don't know
have
how
I don't
the-
have
with a 2-1
enough
yesterday. Jason
service
Spence
on my
and
phone to
Dallas
get on
scored the
Facebook
goals,
to see
and
if
Ben
we are.
Bishop
See, I
stand
get
out
back
against the
feed
Stars 1-2
delay
to
through this
The
mic
series shifts back to
audio.
Dallas now
8 seconds?
tomorrow at
As
the
I'm
Hat
no, it's not 8
2
seconds. It's like
o'clock.
2
Oh,
or
When
1.
the Stars will look to
Oh,
advance
when
to
you're
conference
listening
finals
to
for the
Facebook
first
too?
time since
Like I'm
2008.
listening through you
And
through the
an NBA
mic right
playoff
now.
action yesterday,
On my
it was
headphones.
an absolute classic as the Nuggets fell to the
So you have a delay here.
140 to
1 second,
137 in
2 seconds.
quadruple overtime. The first time a playoff went that
Well,
a
that's
playoff
something I
game
think
went
Saad
that
knows
deep
guys
since
should know.
1953.
You're not saying that
Today, NBA
Facebook
playoff action,
is
just one game on
delayed.
the slate.
You're saying
The
that
Warriors go to
the
Houston,
audio
take on
here
the
is
Rockets
delayed.
to go
Like
up
you
to
hear me on the
another
mic and
game
then
tips off.
like
And
I'm
I'm
talking to the
hearing
mic.
you delay like 1 second. I just don't know how that comes across because of the feed they have here. And then when I hit that direct feed, that didn't go well on that direct feed. Y'all heard that, right?
Yeah.
So I shut that off because it's a direct monitor for me to directly monitor you guys.
Oh, there's the feedback. Yeah, yeah, yeah.
And so I shut
It's
that
hearing
off.
us. Yeah, yeah.
So now I'm only working off feeding it through.
Can I watch Facebook on the computer?
If they have, yeah.
Huh.
Where's the keyboard for that?
Right here.
I can get on my account if I can remember.
Oh.
That way you can see. So you can see.
Yeah. Well, so we can all see what actually is going across.
Yeah.
Oh, that's all you're gonna get.
There's obviously something with these feeds, and I don't.
Well, we're gonna have a phone call right off the bat, so we're gonna find out what Don sounds
You
like.
have spent the
Yeah.
last 10 years or more building a successful business, but the past year has been tough. Maybe you have fallen behind on payroll taxes, and the IRS is trying to come after your business or you personally. I'm local tax attorney Nick Namath with the law offices of Nick Namath located right here in Dallas.
Hey, do you know what the login is for
wondering if
TSM?
you are going to lose your business and
Mayor?
possibly your own personal
No. Go to your. I want to see what other people are seeing.
The IRS is one
So
of the
go to
most
yours.
powerful agencies in the federal government, and it can and will aggressively target businesses and individuals who have not paid or filed their taxes. If you are facing IRS wage levies, bank levies, or tax liens, call me, Nick Namath, today. Your first visit is free and always confidential. Call Nick Namath, the DFW tax attorney, at 972-484-0829. That's 972-484-0829, or go to myiRSteam.com.
Tee it up at historic Cedar Crest Golf Course, home of the 1927 PGA Championship won by Walter Hagen. Designed by A.W. Tillinghast, it's centrally located near downtown with great views of the Dallas skyline. Practice on natural grass tees at the driving range and short game area. Cedar Crest is a big-time golf course at a small-time price. Play this classic gem for less than $50.
Inside Sports Medicine, right, Mayor?
Visit golfcedarcrest.com.
It should be.
Cedar Crest Golf Course. Live, life, and
I don't
golf.
know.
When it comes to autism in DFW, 29 Acres is leading the charge in helping adults every step of the way. This summer, they're launching a 6-week summer transition experience for ages 16 plus, focusing on vocational opportunities in adaptive lake sports like wakeboarding, paddleboarding, and more. Year-round programming then begins in the fall. 29 Acres is asking their community to help fund scholarships by donating $5 per month. That's only 1 cup of coffee, people. Donations can be made at
Mayor, we on this?
29acres.org/donate. That's 29acres.org.
Wait, go back to that.
Donate.
I want to see if that's.
Still living with neck or back pain?
No,
that
this
just
says live.
won't go away?
From me going Inside Sports Medicine. Click
Yeah,
on it.
but see, that's not the hat he has on right there.
It is not. Yeah. Well, but I'm wondering if that.
At the Center for Disc Replacement, Dr.
It'll be on there
Dr.
live.
Geyer and Dr.
Well, I
Zimmer
just switched
have
off of it, so
thousands
maybe
people
it'll
from
take
all
a
over
second
the
to
world
go.
with
It's
this
there though.
motion
Go to
preserving
video or.
procedure. Do it today. Don't have pain by going online to the Center for Disc Replacement at Texas Health
Videos?
Center for
Live?
Diagnostics and Surgery at thcds.com/center
Yep,
for
there's his
disc
hat.
replacement.
Yeah,
The
that's
2019 AT&T Byron Nelson is back in Dallas.
Oh, and there's you leaning in.
Jordan
Yeah.
Spieth and Tony
Yeah.
Romo,
Oh,
along
we got
with more of the
first
world's best golfers, next Thursday through
I love
Sunday
that.
at Trinity Forest Golf Club. Tickets are on sale now at attbyronnelson.org. See you next week.
This program brought to you by Progressive Insurance. Last year, over 3 million drivers switched to Progressive. Call 1-800-PROGRESSIVE.
Hey, why does that say this program brought to you by Progressive Insurance? Well, we need to definitely talk to somebody about that.
About the on-time expert? It was probably installed wrong.
Randy, you're not saying.
Oh, I'm saying it. Some joker goofed up the ductwork on 90% of the air conditioners we see.
Fix that.
No hot spots, noisy systems, and electric bills 60% too high.
Holy.
We'll fix your AC if we can.
Oh, wow.
When it's time to install a new one, it's
Push
gonna
play.
be right.
Guaranteed.
That's the only way
I like the
know
way
how.
you say that. You know, I've been pushing play right
No, I didn't know you were doing
Just
it.
push play.
Every day, mornings
Oh,
5
that's
till
the
9.
big
on
triangle in the middle of the
ESPN
screen.
Radio,
Yeah.
103.3 FM.
Go ahead.
ESPN.
So how do we know if we're on?
Inside
Believe me,
Sports
we're on.
Medicine with Dr. T.O. Soria.
I think the internet is a little
orthopedic
slow
surgeon
here.
and medical director of Texas Sports Medicine and Orthopedic Group. Dr. Sorial's comments are meant for informational and educational purposes only, and not as a treatment. His comments are not a substitute for a visit with your doctor. And now, Dr. T.O. Sorial.
Welcome back to Inside Sports Medicine. T.O. Sorial here, live in the studio. Dr. Mayer, Dr. Ballard, the young guys. We are live in the studio on this overcast, rainy Saturday, but I am told by reliable people that the weather will clear up and we will have a spectacular weekend here in North Texas.
We got all kind of stuff going on in here in the
Yeah.
studio between Facebook, video, audio issues.
Yeah.
Mayor is the audio video specialist this morning.
Well, the good news is you can hear us the old-fashioned way on the radio.
That's right.
Or KESN1033.com. Go to the live, listen live icon. You can hear us anywhere on the planet. The text machine is 21000. Start off with the 4 letters ESPN. Doesn't matter if they're capital letters, lowercase letters, doesn't matter. It just has to be those 4 letters. And then your comments will come directly to us. The question of the day, and each of us is going to take a turn to try to answer it. The question of the day: what sport do you think requires the most talent? I don't know that there's a right or wrong answer. But, as promised earlier, we're going to go to the phone since Don got on before we actually came on live. Let's go to Don from Garland. Quick question. Hey, Don, what's up?
Morning.
Well, the answer is it might, but what are we using it for? Are you arthritic? Do we know that you have a problem? Yeah. Okay. So I'm going to answer the question just in general. So that have been used for people who have joint arthritis, and they are considered supplements so that they are not regulated by the FDA, and these are naturally occurring supplements. If you have a diet that includes meat, you're probably getting glucosamine and chondroitin, and this has been around for about 20 years, I'd say, where people have been using these supplements. You get them from a nutrition store to make your knee symptoms diminish. The answer is, for some people, they swear by it, and there are some people that get absolutely no benefit from them whatsoever. There is no scientific evidence to back these supplements, and I think part of the problem is there's not really been any good studies on it. But in addition to that, because they are supplements and they're not regulated by the FDA, it's awfully difficult to determine the dose. How much glucosamine or chondroitin do you need? It seems to be somewhat haphazard. So that being said, go ahead and try it. If it works for you, great, fantastic. If it doesn't work for you, you haven't lost anything. Well, I don't think there's a right or wrong answer, and I agree with you. I think a baseball player who is trying to hit a little round ball that's coming at you at 100 miles an hour, and also trying to make those diving stops at shortstop, for sure, that wouldn't be my vote, but I think that we're going to put a 1 next to baseball.
Yeah.
Hey, did I answer your question about glucosamine? Perfect. All right, thank you. 855-787-1033.
And real quick, just to extend on the glucosamine topic, I mean, I just tell my patients it's not gonna hurt. I don't think it's gonna hurt you. It's like you said, some people swear by it. I want to say, I feel like I've heard that it has to be consistently done for like at least 6 weeks before you can really say whether it's gonna do something for you or not. Like, you got to be pretty consistent. It can't be like you take it one day, you don't take it a couple of days. It's got to be pretty consistent if you're going to try it.
Well, and I agree with you. What I heard is that you got to be on it for at least a month before you look in the mirror and say, is this working?
Right.
And I don't know. I don't know. Do you have any thoughts on glucosamine, or are you still?
I'm still trying to mess with video. My 2 cents on the glucosamine is, are you talking about I couldn't hear the caller. Oral supplementation. So the problem is with the literature of the injection. When I directly inject it, the literature is mixed. So there is no way in my mind that oral supplementation is going to be any better than a direct into the knee, intra-articular supplementation of what you're trying to get via your. The idea orally is that you take it and that the building blocks will build in, and then hopefully you will then create the hyaluronic acid chains in your knee.
Right.
When we're directly injecting it, you're asking too many steps on the oral side.
Well, and what people need to understand is that glucosamine naturally occurs in the cartilage in the knee. That's the idea, is that we're given, like you said, the building blocks, the cartilage, for someone to ingest, and then hopefully it'll turn into some maybe sort of cartilage repair over time.
But somebody else keep talking. I have to respond.
So listen, everybody, we're trying some different audio visual, and I'm saying visual because yes, we have a visual portion of the radio show now because we've got Facebook Live, but as much as we are experts as doctors, we're trying to be experts as audio visual. I mean, what would you call us? Amateurs in the audio visual.
We are below amateurs. I mean, I don't know where that ranks. We are below amateurs.
So you have to forgive us this morning, but
so I just got a text that we are live and they can hear us and they can hear the caller.
Awesome.
What?
They can hear the caller.
Well, not sure we can hear the caller, but we are live and we look great.
Oh, if they can hear the caller, that's great, because that's not what I was thinking was happening.
Well, hang on. She's not sure about the callers. We're going to have to try the next caller. 855-787.
Somebody call.
Somebody call. Yeah, somebody call. How about the callers?
855-787-1033.
Thank you. So I'm going to... I have so much on my list.
We're going to talk about Harden's eye. I want to talk about Harden's eye.
That's on my list.
Oh, really?
That's on my
Harden's
list.
eye. We got to talk about the referee and the rules and some of the sports medicine spin on that.
Yeah.
On the 3-pointers and the fouls not getting called, and from a sports medicine perspective, go back to the Kawhi Leonard. Go back to the Kawhi Leonard injury and how that changed that series. Think about that.
Who was the big man? Who was the big man who stepped on him? Who stepped into his area when he landed?
It wasn't Green, was it?
No.
No, not.
Yeah, one of Saad will probably know. But
Pachulia?
Yeah, Pachulia.
That and then a finger dislocation between a finger fracture, between with Steph Curry, non-dominant hand. How is that going to affect him at all? Will it affect him?
Look, there's a reason why this show's been on the air for 18 years, and the reason is that sports medicine is relevant. And there's another, and we're on ESPN, for gosh sakes. I mean, we're not on some obscure station in Tulsa. We're on ESPN Dallas.
No offense to Tulsa.
Yeah, no. Didn't mean to offend
Kevin Brown because he's from Tulsa.
Yeah. So I mean, there's a reason, and the reason we're on the air is because sports medicine is relevant. Sports medicine is a big part of the playoffs. It's and Mayor, you brought up something fantastic. Your dislocated finger.
Yeah.
Most of us would kind of blow that off. Yeah, we're in this.
I know you all saw that.
Yeah.
They were like, it's playoff time.
Yeah,
Man.
pop it back.
Yeah.
Most of us would blow that. But if it happened to me or you, we're done for a month.
Yes.
I'm done for a month.
Yes.
Are you kidding me? My finger's pointing to left field. And I'm supposed to go back and do surgery? Nope. I'm done for a month.
Yeah, it's amazing how players can play with that and buddy tape it right next to the other one and get the motion going immediately. And if you can reduce them immediately, they almost like nothing happened.
But I mean, it also goes back to what we've talked about before. It's playoff time. Sports medicine and how we practice sports medicine is completely different based on risk versus reward.
Now, Steph Curry's lucky when he dislocated his finger, there was no fracture involved.
Right.
Because when you dislocate a finger, it doesn't always just the two bones pop out of place.
Right.
Sometimes a big piece breaks. If that happened,
changes the entire complexion. The entire complexion of the playoffs changes.
Yep.
Yeah.
Yeah. Inside Sports Medicine, 855-787-1033. So, I don't know why we can't see ourselves, but others can see us.
This is slow. I think the internet here is a little delayed.
Others can see us, and they say we look great.
Oh, man, that's good.
Yay. I'm not sure about the hearing us part. So, on my list, yes, you kind of stole a little bit of my thunder when you were talking about all the different injuries in the NBA playoffs. Yes, we're going to definitely talk about the NBA playoffs. Dr. Ballard, as a certified ER doc as well as a sports medicine fellowship trained doc, you got the best of both worlds. What do you look for when someone like Harden gets that thing in the eye? Because it looked horrible. It looked horrible. When do you get worried and you say, wow, this is not good?
Yeah, so on the sideline, you've got to be able to do an ocular exam. You got to look at, is the eye, moving like it should? You got to look and see is his vision okay? But a couple of things that come to mind initially when I saw the injury was, so the front portion of the eye is called the cornea. Literally, if someone were to just poke you like directly in the front of the eye, that's the cornea. And the cornea is made up of cells, just like cells on our skin. It's kind of like the skin of the eye. And you can have a corneal abrasion or a corneal laceration, just like you would on your skin. You can have an abrasion on your skin, you can have a laceration on your skin. And depending on the severity of it, could really change the complexion of the playoffs.
What about complexion of your vision for the rest of your life?
It could, yeah. I mean, because and so not just the corneal abrasion, but Mayor was covering one of the football games for the Texas Revolution that we cover.
Yeah.
And a lady got clocked in the eye with a football, as a spectator. And so, I was kind of helping him from a distance. He was sending me pictures because another injury that you can have is something called a hyphema, which is blood entering into the front portion of the eye, which there is not supposed to be any blood on the front portion of the eye, because that means there's a violation of those two different areas of the eye that can affect vision long term. So there were a lot of different implications, but so many things related to that injury because it's not a typical injury, and you have to be prepared and have things on the sideline or in the locker room to be able to assess whether he has that abrasion or not. It's not that maybe he would not play anymore if he had that abrasion, but you got to at least know because he's going to have to be on antibiotic drops afterwards. He's going to have to follow up with an ophthalmologist like next day. So, it affects things, but.
Unfortunately, in basketball, it's one of the more common injuries. Guys get poked in the eye, raked across the eye all the time, and I had to learn about that. Simply, if you're going to be the doc on the sideline, you're not going to have an ophthalmologist handy, but you have to know what to do. And
at least identify ocular emergencies, and there's a few, right?
So the things that I had to be familiar with is exactly what you said: a corneal abrasion. And do they still use the black light and the fluorescein and all that?
That's right.
My little doctor bag, I had that in it. I carried it with me because I needed to know.
That's exactly why our practice is called Texas Sports Medicine. It's not Texas Sports Medicine, orthopedic surgery, orthopedic surgeon.
Where are you going with
medicine? Because as a sports medicine doctor, players get all types of injuries. It's not just orthopedic. It's skin stuff. It's eye stuff. It's other things. It's general surgery stuff. You got to be able to recognize cardiac stuff. You got to recognize abdominal things.
And that's what I that is my passion about sports medicine, is that I'm not just an orthopedist. I have to know about measles. I have to know about measles.
Real talk.
I have to know about, cardiac issues. I probably know more cardiac issues than 90% of orthopedists in the country, only because if I'm covering an event and there's something cardiac going on, I don't want to look like an idiot. I want to know what to do. I love that about sports medicine, and we all do. That's why we're in this room and we're sharing this with you. We love that. All right, quick little break. Inside Sports Medicine, 855-787-1033. Several of us have told us that we are live on Facebook and we look and sound great. The only part that we're not 100% sure about is, can you hear the callers when it comes in? So text us. Let me know. I don't know.
And then off the text machine, we got votes for golf. We got a lot of votes for track and field.
What?
For the sports.
Oh,
so the most talent.
So the question, and look, this is going to create all kinds of calls, and I'm excited about that. If you want to text us your answer or your thoughts, that's great. If you want to call in your thoughts, that's great as well. 855-787-1033 or 21,000 on the text machine with the 4 letters ESPN. What sport do you think requires the most talent? And you're not going to win anything, and I don't know if there's a right answer, but I'm curious what people think. Inside Sports Medicine, Sorial, Ballard, Mayer, all coming right back.
Our ESPN radio insiders have the latest info and analysis.
We use that as a segment for the ocular stuff.
If what I figured out works for the callers, because Renee said she heard the callers. So if they're hearing the callers, I can't hear it. I can't hear anything. I'm on delay. Guns N' Roses.
Guns N' Roses, Sweet Child of Mine.
I can't hear anything. And when the callers call in, I can't hear anything through mine. And when you guys talk,
because you got the thing plugged in?
I'm on like a 2 or 3 second delay.
I have an idea.
So
why don't you plug that in somewhere else?
No, I'm going to leave this setup plugged in here so I can control this. Okay. And I'm going to listen via a different.
Right. I get it.
And that may solve it. Because if that's working,
but you can hear the listeners, you could not hear the listeners.
I can't hear the listeners, and I can't, and then you guys are like 3 second delay, so I can't. It like trips me out.
So is that what's happening? Was that happening last week?
Last week we were.
You have another. Which one can you go into? Because can we switch?
I have a splitter.
But how much length? Because if not, that's not going to reach to that one. If I go to yours,
do you have enough? How long of a cord do you need?
Wait, hold on.
No, I have a splitter.
Well, the other option is I can plug in right there to this and then plug mine normally.
Yeah, I thought you were going to plug into the closest one next to you.
all over the world with this motion-preserving procedure. Do it today.
But that's what I'm
That's
saying.
all
Do
you
you have,
got.
do you have more room from him to him or
unplug that. Watch, I'm gonna do this. Give me that.
Surgery at
I may go to mine here.
Center for Disc Replacement.
Because this one's got more room to jump over to that one.
200 cookies for my bake sale tomorrow?
Let's do this. Include check NHTSA.gov/the-right-seat to make sure they're correctly buckled in the back seat. Brought to you by the
Abby has a question for you to do it on the air.
When you were a kid and got hurt, you'd go to your mother.
For TLC, someone to stand up for you.
Same goes now
This
if
is
you're
their
hurt by a
question,
drunk
just wanna ask
driving
a
Well,
crash.
no, she
Just go to the
texted it.
mothers.
Mothers Against Drunk Driving.
MAD for short. Mothers who know what
When
to
do you
do.
handle?
Call
When
877 MAD
she's
help.
clarifying
That's
it
what
because I
you
didn't
get.
understand it.
Help and
When
no
do you
charge,
handle
of course.
ortho stuff
Learn more
yourself
about how
in
we help
ER
victims of
versus
drunk
call
driving
somebody in?
next time you visit.
ortho
Mothers
stuff?
Yeah.
always love a
It's a good
visit
question for this
at
is your own.
mad.org.
Radio. It doesn't require you to drive by it, pick it up and read
Hey,
it.
how many other mics do we have then?
Well, there's 1, 2, 3, 4. There's 4.
So if Blumenthal came, he's sitting over there.
Yep.
We're good.
Yep.
So I could use that one.
One of these doesn't work, and I'm not sure which one it is. One of them.
This one kind of.
One's fuzzy, one doesn't work. So we have a caller, so we're gonna be able to find out right away whether it's working or not.
Oh well, this works. Now I'm on you guys, and then if that thing works, then golden.
Sports
Then
Center
that's
update.
it.
Live from the Driver Select Sports Desk.
Yeah, because I could not
Morning, I'm
focus.
Todd Houston with the Sports Center update.
Yeah.
Jason
I can-
Spezza
oh, you mean with the
scored
delay?
early.
Oh,
Vanessa Lindell added
see how they throwing you
another one,
off.
and the Stars beat the Blues 2-1
And you can't hear the
yesterday
caller
in
and
St.
the
Louis
delay.
to move
But
to
if this
the
works now with this
Blues in a
mixer
great
off of that
elimination.
off
The
that
Stars
feed,
come back to Dallas tomorrow.
because then I can
Puck
just
drops at
control the
2
shots
o'clock.
from here and I don't have to
If
mess
they
with the
win,
sound.
they advance to
Is this
Western
doing
Conference
anything,
Finals
Doc?
for the first
I
time
think it's moving.
since 2008. In other NHL action yesterday, the Hurricanes beat the Islanders
I can get off that.
5-2
Just get on
to
your phone
complete
like you
the
did last
sweep.
week. Do it off your cell phone.
In NBA playoff action yesterday, the Bucks beat the Celtics 123-116. Giannis had 32 points, 13 rebounds, 8 assists in that one. And then the late game was
I got a text saying
you watching the game tonight?
Quadruple overtime, 140
Sorry?
to 137.
Now what you
I'm trying to figure out what you're doing, man.
What do you
Like,
think?
65
You
minutes
are
in
watching
that
the
one.
game.
TJ
We
trying
on
to
do
figure
you
out.
want
It's
to get
basically
it
a question to say what we trying to watch the
Yes,
game
I
again.
do. You want- what do you want to do?
Yeah,
I'm I got. I'm free.
Free like the family here.
What's the best
Well,
way
we
to
might
buy
be going
your next
on. I
car?
wanna watch
Thousands
the game.
below the local
What
market.
time is
Shop
the game?
driverselect.com. At driverselect.com, you get the price with all the taxes and fees,
it's
trading
late.
value, and their
No,
lowest
it's not
financing
late.
rates
It's
on
just
hundreds of
my,
vehicles.
my
Still
pastor was
under
asking me to
warranty.
get together with it.
And Echo
Now,
Park
now that I said it,
Quake
gonna
Peter L.
they gonna be like,
Insider
man,
has
you say you
inside
gonna
pitch
get
on the Texas Rangers, the AL West, and the stories
Oh,
from
they gotta win
Major
this game.
League Baseball. It's the
Oh, yeah.
Benson Law Firm Rangers Insider. It's
Yeah.
at 6 and weekends 1
I need to
hour
get a
before
Rockets.
I need them to get into their set faster in the last 6 seconds of the shot clock.
It's ISO ball, man.
I
Like
know.
what you want. I mean, like it's ISO ball. It's,
But that's fine. Go ISO ball like early.
speed up that ISO ball.
So I have a story about this song. Welcome back to Inside Sports Medicine. T.O. Soriel. Wait, keep it handy. Keep that music handy. Welcome back to Inside Sports Medicine. T.O. Soriel here, live in the studio, live on Facebook. Dr. Mayer, Dr. Ballard, we're all here. Hopefully you can hear us. The phones are already ringing, 855-787-1033. So, about 5 years ago, my sister who lives in Los Angeles called me and she said, hey, I'm at a school auction and there is a guitar lesson available by Slash from Guns N' Roses.
Get out of here.
Yeah. And if I bid on it, do you want it? I said, heck yeah, I want it.
You know how to play the guitar? Because that'd be like drinking from a fire hose. Could you imagine that?
Imagine he's
Hey,
coming down.
Do the music back. Do that song one more time. Do that song one more time.
That's like asking like Tiger Woods to dumb down his golf game for you to learn.
No, where's
It's
the
like
intro?
Cherry,
that
bro.
little,
It's
that
like
little
Cherry.
quick little lick.
You know, like let me just get this done with.
That's
You
it.
know?
All I wanted to do was learn that.
That sounds simple, Doc.
I think I can do it. I think I can do it.
This is the surgeon.
I know.
This is the confident surgeon.
Yeah, no.
Yeah.
Listening to something, saying, "I think I got it."
I got no music.
I think I can do this.
Zero. None.
Which brings us back to our question of the day. What sport do you feel requires the most talent? And now that question came from my dear wife, Karen. It was just said in passing, and I looked at her and I said, wow, that is a great question. I'm gonna tell you my thought, and then we're gonna go to the phones. I'm gonna say hockey. And I'm only gonna say that, and I'm not sure there's a right or wrong answer, because I cannot stand on ice. I cannot stand up on ice with regular shoes. Therefore, I cannot stand on skates on ice. Therefore, I cannot hit a puck.
That is the most simplistic reasoning for why you think someone is talented.
Have you seen what those guys are able to do on ice?
Oh my gosh.
They are skating backwards. They are doing circles. They are knocking each other off balance. To me, that is absolutely the gold standard of talent. But that's
Hockey
just
is
me.
the most skilled sport, you're saying?
That's what I'm saying.
I'm going to totally disagree with that.
Totally?
Completely, 100%.
Well, look,
because of your rationale, skating is the reason that these guys are talented.
But I understand your I understand your rationale. I mean, I don't know if I agree, but I understand how you're coming with that idea as the as why you think it's the most skilled sport.
As I said,
at least you have like a way of thinking about it.
As I said, there's no right or wrong answer.
Right.
And I'm sure all of us have different...
There's no right or wrong, but there are some ridiculous answers. There are some less ridiculous.
I don't know how you think that's ridiculous.
I think it's ridiculous. That your prerequisite to them being a great talent is they know how to ice skate. Have you been to the Galleria? There's like 5-year-olds cruising around. There's like 10-year-olds killing it. I mean, that is not a prerequisite to be the most talented athlete. I mean, there are so many...
I think you're missing the point.
I think you're oversimplifying the point.
Maybe I'm oversimplifying. Thomas.
Oh my God.
Thomas from Sherman. Good morning, Thomas. What's up?
Ask Thomas what his thought is on the sport.
Are you there, Thomas? I hear our radio.
You got to turn our radio down in the background, Thomas.
Is that us?
Yeah, I think Thomas just put his phone down.
He's at the drive-thru getting morning coffee. He may have to call back.
You know what? I don't want to listen to that.
Tell him to call back.
Oh, Thomas, you're on. Well,
yeah,
sorry,
yeah.
Thomas.
Thomas, you're gonna have to call back on this. So, I just got on via text gymnastics as the most.
I was thinking about that. See, I hadn't formed an answer yet.
Yeah,
I'm still.
It's how you define talent. Natural talent, like what you're born with talent.
I don't know.
Talent that you have to develop to get to that level of the sport. Because if that's the question, I may pick golf. Yeah. Some type of individualistic sport that's not so. I mean, the amount of the mental game, the just repetition, and how you see changes. You know, in the golf landscape.
I think this is what makes this question so fascinating.
Yeah, there's so many different answers.
All right, so Thomas is back. All right, Thomas, now you're up, buddy. What's up? What? Can we not hear him?
Thomas, you got to turn off your radio for us.
I don't know. I don't know what's going on here.
I don't think there's a strike three. I think. Thomas had a second chance.
Well, think about this, and I'm not a technical genius. If we can hear what's going on in his phone, why can't we hear him?
Right. Why? I think it's because he's not either. I don't think he's talking.
Well, somebody's calling.
Oh,
somebody's
calling.
Yeah, he called in twice.
But I don't know whether he's talking. Right.
Yeah, it's got to be a Tom.
or
it's not a
or it's a Dr. Mayer switching and messing up something, but I didn't.
No, because we could hear. We could hear.
Y'all could hear the last caller?
We could hear.
All right.
We could hear his background.
On the text machine, just a side note, when talking about a veterinarian texted in saying, hey, you guys are like me. I got to know everything about animals and their medicine, and I'm a vet, and I got to put them back together.
I absolutely love that. Remind me to tell you, and I'm not going to waste valuable airtime. I spent, 1 hour long conference call yesterday with the 2 veterinary orthopedists at the University of Wisconsin School of Veterinary Medicine. Conference call yesterday about ACLs and dogs. Fascinating discussion.
How did that happen?
Yeah,
please.
Yeah,
just give me the short.
Yeah,
give us all the short
story.
Give us the
setup to the meeting.
How Dr. Sorial ACL extraordinaire. Is talking to the University of Wisconsin School of Veterinary Medicine
for ACL tears in dogs.
This is what I want to hear. I'm being a little selfish.
Do we have a drum roll, please? Can we have a drum roll?
A drum roll?
Because
you're not getting an award for this, right?
I think it's great.
No,
I just want to hear about it.
Okay. All right, so here's how it came to be. Dr. Mayer, who I love dearly, but sometimes irritates the crap out of me.
Where is this going?
Dr. Mayer talked me into giving.
That's your
the drum roll?
Bam. Boom. Boom. You're on.
Dr. Mayer talked me into giving a talk to 400 people next week. And it's a talk on ACLs, and it's a talk. And so I figured if I'm going to be giving this talk in front of so many people, I need to kind of do my homework. So the amount of work that I have put into preparing this talk would boggle your mind. What I'm doing is I am giving folks the 50,000-foot view of where we are with the problem of ACL tears in athletes, where we started, where we've come from, and what the future holds. Mind you, I have 15 minutes to do this. And my theory is that there is clearly a family predisposition. There is clearly some sort of genetics, and there's a physics component, and so it's complicated. So as I was researching 22,000 different articles, dude, my eyes were blurry. As I was researching 22,000 different articles.
Trust me, I walked by the computer and watched them start doing the PowerPoints, and I was like, oh man, this is great.
And I came across an article from the University of Wisconsin School of Veterinary Medicine about the genetics of ACL injuries in dogs. So, and it was about 3 or 4 years ago, the article. So, on Monday, I called the secretary at the University of Wisconsin School of Veterinary Medicine, and there was a list of 10 authors on the article. And I said, I'm Dr. Sorial, I'm from Dallas, blah, blah, blah. I do a lot of work on human ACLs and blah, blah, blah. and are any of these 10 people still around? So I started reading off the list of authors on this thing.
This was published 3 years ago?
Yeah.
Golly, your bar was set real low.
So it turns out 2 of the 10 are still there. One was a student at the time she wrote it, but now she's a faculty there, and the senior author was still at the University of Wisconsin. So she wouldn't give me their phone numbers, but she said, look, I'm gonna relay your interest to them and see what, if they respond to you. Well, Wednesday, the young lady did respond to me, and she said, why are you inquiring? What are you doing? I said, look, I think there are parallels between humans and animals. We often do studies on animals to learn about human diseases. And I'm curious about your work and the genetics and all that stuff. And she said, well, let me talk to our senior guy, and we'll get back to you. So Friday, they set up a conference call. Absolutely fascinating. ACL injuries in certain breeds of dogs are rampant.
Oh, wow.
Are epidemic. 5% rate of ACL injuries in Labradors. And these people at the University of Wisconsin have done a tremendous amount of work on this, and they clearly think that this is, it runs in the breed, for God's sakes. 5% risk is huge. In humans, it's like a 0.1% risk. In the Labradors, that's a huge. 1 out of 20 dogs is going to tear, Labradors is going to tear their ACL. And just being a dog. They're not involved in sports, they're just being a dog, and they tear their ACL. So anyway, so we talked for an hour.
So no Labrador collisions?
No contact injury. No Labrador contact injury.
Labrador injury.
Fascinating stuff. And one of the things, and you're going to hear this in my talk on Thursday, what they have determined is that there are probably thousands of genes that go into this trait,
that contribute to it,
to this trait,
right?
And he thinks that this is probably the same as it is in humans, which is why it is so difficult to say, well, it runs in your family, this is the gene responsible. It's not a single gene that determines whether your son or daughter are going to tear their ACL or not. It is 1,000 different genes. Again, the summary is, yes, it's genetic in dogs. There's no reason why it can't be genetics in humans, but we're a long way from being able to do that. And a little sidebar, I don't know how this stuff works. We're going to collaborate together on a study to find out this thing called heritability in humans.
So, how much time we got?
None.
All right, I got something that I got to say whenever we come back.
So you asked the question, how did this happen?
Yeah, well, we need to know.
Yeah, I think this is awesome. But we'll,
fascinating.
Go ahead and take us out, because I have something I want to say whenever we come back.
Inside Sports Medicine, Sorial Ballard, Mayor, live in the studio and on Facebook. Phones are going crazy.
Yeah, we got George coming back. We'll talk to you about knee and stem cell questions. We'll finish that in Ballard when we come back.
Quick break.
Yeah, if this works, I got to know if this call comes through.
Yeah, no, this is big.
Is that thing moving?
Yeah, I can make it go on you. Bam, it's on you. Go ahead.
Oh, is that what the light does?
Oh, is it moving?
Yeah. Do it
Okay,
again.
hold on.
Do it again.
Now I'm going to go to you.
Yep.
Now it's on you.
Do you.
Waving to the camera, and then hold on. This is the wide shot.
Did you have it on him when he was talking?
And then that's the wide shot.
So wow, this is fantastic.
There you go.
So now we know exactly.
Hold on, so do it again because I want to see what
So I can move it around. So Ballard.
Oh yeah, so we'll delay. Yeah, I see.
Then I can send it over to you.
Okay, I need to slide over.
You just got your turn. Hold on.
I'm right there.
I think I need to be.
Hi, I'm Lorna. Once the
You know what?
IRS ceasing my money, including my social security,
move your mic the other way.
Someone just texted me.
Yeah, move your mic the other way.
the IRS over
No, I mean, put it over here.
and she
Oh, I
thought
see.
this
Out of
property
my
was
way.
unsolvable. Once I hired Nick, they were able to stop the IRS.
Hang on, there's a little delay. It's moving now.
And
No,
they
put it on
also
everybody.
prevented the IRS from taking my
Yeah,
paycheck.
hopefully I've heard this
Today,
thing
my
right.
I think that's
IRS
better.
problem
Yeah,
is over.
because I got a straight shot now.
You're just going to have to tell me if if this caller comes through.
Direct it.
Hey.
Move the.
Oh yeah. Now I've got a full
Hey, I'm
frontal.
just going to say,
Okay.
this,
There's something wrong with you people. There's absolutely something major wrong with you people.
There's something wrong with me. You just said, "Oh yeah, that's it." You got a full frontal right there. Come on, man. I mean, that's you walked right into that.
How is that any different?
this is the first time I've gotten a green light on this thing, so I must be doing something right. I got a green light.
Green is always good.
I haven't gotten a green on my mixer board before.
But what is that for? That's
For
audio.
That's if I want to listen to our audio, but when I mess with that, y'all got horrible feedback. So I'm not going to mess with it. I'm just going to let the feed run through there, through this, and mess with the game. I just got to know.
I got a great view of you. Unobstructed.
I just got to know that they can hear everything.
And unobstructed on you, so that's good.
Yeah,
That's good. I like the setup.
Give us
Next
a
time, remember
couple
that.
weeks. Yeah, we gotta remember this is the setup.
We're getting it smooth. As long as the caller comes through, then we're
Yeah,
good.
so Judy said she couldn't hear the last caller, Thomas.
Well, we need
But we
to-
couldn't.
Oh, that's right.
Recognized physicians at the Center for Disc Replacement, Dr. Muriel, Dr. Guy,
Yeah, so how did I have a conference call with the University of Wisconsin
Dude,
Department of Veterinary
you can't
Medicine?
make this stuff up.
That is how it happened.
You had me rolling when you were like,
to the Center for Disc
freaking man. You got me doing the talk.
Hey, you know what?
I was dying. Because I could see.
Hold on, when the cameras go on, does that mic go on? Because I'm plugged into here.
He has to turn the mic on. So you tell him to turn on all four.
To turn the mic. But I think you should be able to hear though, right?
Well, no. You can't hear unless the mic's on.
Really?
Our people are.
Because I wonder what's going on with that.
Unless the red light is on, this is not on.
Yeah, but how is...
I'm gonna ask him. Hey, when you turn the mics back on, turn all four back on.
Well,
All
there's
four
more than
mics.
four.
Just turn them on
More
because
than
that way
four.
we can listen from, if that's possible.
Yeah, for like the callers,
Yeah.
it's not gonna really pick up unless you guys all turn your mics off. 'Cause if that mic's on the whole time, it's still not gonna pick up a caller.
We're trying to pick up the callers off the headphones.
You can't hear it off of here.
Right, but I'm saying you're gonna have like a headset right on the microphone.
Yeah. So
It
the
may
question.
not sound good, but we can try it. Hope
Well-
it doesn't cause feedback though.
Well, because the other alternative, Taylor, is we're not getting any caller sound.
Yeah, I know. I feel for you guys.
Well, so last week.
Well, if this caller sounds bad, then I gotta change this.
We're back.
He said, "I feel for you guys." Thanks.
I am so proud of my boys. So proud of Ballard and Mayer.
I know this one.
They picked this song.
Yeah.
I know this one.
I'm proud of that.
Yeah.
This is.
I'm proud of myself.
This is good stuff.
I know that song.
Inside Sports Medicine, Sorial, Mayer, Ballard, live in the studio and on Facebook. We're gonna go to the phones. George from Argyle. Good morning, George. What's up? Can't hear George.
All right, so hold on. Let me unplug
All right,
this.
we're gonna have to figure something out here. George, try it on. Try it again. Still can't hear George. That's 2 in a row now.
Saad, can you guys hear George? You can't hear him. Nope. There we go.
Hey, there.
There we go.
Yes, now we can hear you. Was that on our end or your end?
Try it again.
Ah. Wait, did she already have the surgery? Okay, all right. Yep. Yeah, so I'm gonna give you my 2 cents worth. No, save your $3,700. Here's the thought. Okay, first of all, I like the entire concept of stem cells. I think that the future of medicine is going to revolve around stem cells. However, as of right now in 2019, it appears that the most promising stem cells are your own. And if you were to tell me that someone was going to do stem cells on your wife's arthritic knee, and they're going to get it from her own body, whether it's bone marrow or fat, I would say, yeah, it's probably worth the gamble. But if you're telling me that they're getting it from a jar or from a vial, then I'm going to say I would not do it, because the science does not support that.
Yeah, George, Dr. Mayer, I'll take this one here. So there's a whole lot of stuff to unbundle from your question right there.
Let me summarize this for the Facebook people who may not be able to hear the callers. So George is asking, his wife had a knee replacement on one knee 8 months ago, is not doing well with it, so she's apprehensive to have knee replacement on her other knee, and she's looking into alternatives such as stem cells. They are under the care of a holistic chiropractor, and he's recommending placental stem cells. So that being said, he asked me what my thoughts are. Would I do it? I already answered the question. No, I wouldn't. Now, Mayor?
So, yeah, George, I'll take this. So to unbundle everything, so first of all, you need to know why the knee replacement is giving trouble. There needs to be a diagnosis. There needs to be some reason why, because there is a whole host of reasons why someone has pain after a knee replacement, and until you find out that reason and get to the bottom of it, I'm happy, we could see you. I'm happy to give you second opinions of other fellowship trained joint replacement surgeons, but you need a reason. Number two, When you go to the other knee, now you're hesitant because your other knee replacement didn't go well, so now you're fearful to take that same track to the other knee. So you see a chiropractor who's a holistic doc, and they're offering you placenta-derived stem cells. All of that is a little bit of a misnomer because there is no live stem cells in placenta-derived tissue. We actually talked about this about 2 months ago or a month ago. Publication came out testing all these on the market, and they found 0 live cells. The reason you're being offered that and not something from your wife's own body, whether from the fat or the bone marrow, is because that chiropractor has no ability to do that or to harvest that from a surgical manner from your wife. So they don't have that aisle of Home Depot is not in their tool bag. They can't go down that aisle. That's just not part of their repertoire or ability to treat you as a patient. So they'll offer these things because it's readily available, it's off the shelf, and it was never approved as anything live in terms of a drug or anything like that. It got approved as an allograft. We've talked about this a ton of times. That's how it got to market. I would not spend $3,700 on that whatsoever. When it first came out, we told these companies, all right, if you believe in them, give it to us for free. We'll try them on our own patients. We didn't charge anybody anything. I never got one person that told me, wow, that's awesome. That was the best thing ever. You guys should sell this stuff. No, that's never been the case. All those placental-derived injections have only shown a little bit of growth factors, which are basically what we call these little chemicals in your body that help stimulate whether blood flow or stimulate collagen growth or stimulate healing. That's all that's kind of been shown to have it. That's not going to do anything better than what platelet-rich plasma does that we know is alive and comes from your body and is probably, 20% the price of what you're being asked to pay. So that's a whole lot of information there, George. Yeah. Hopefully you can wrap your head around that.
But George, I like what Mayor said, and I get it. I mean, you're hesitant to do the knee replacement for this other one, I'm assuming because, there's arthritis. You have to figure out why that knee replacement is not relieving pain, because that's what the surgery is for. It's a pain relieving surgery. But I also understand, I feel like the word holistic is attractive because it suggests non-surgical. But there is a way to have and be seen by a doctor, MD or DO, who may not say, you absolutely need surgery, and still be able to do stem cells that are actually stem cells and appropriate for it. But you'd have to be evaluated by somebody who's sports medicine, who knows how stem cells work, the best type of stem cells that they would need, and see if she would be a good candidate for it. But the word holistic, I feel people can almost interchange that with, well, I just want some non-surgical options, right? I want more options than the surgery. And if you go to the appropriate sports medicine and orthopedics type of people who will give you a wide range of options, see you, take time, listen to you, and see if this is something that's a fit for her, well, there might be what you consider to be
holistic options, but still non-surgical in our world in terms of how we call it, and be able to have a good outcome. George, first of all, fantastic question. Great question. I'm glad you called in, and we've bombarded you with answers. I'm going to summarize. One, holistic, I think natural, and maybe that's what they're talking about. And there has been I don't know exactly how to phrase this. There's been a cash grab in the medical world with the term stem cells. Everybody is saying stem cells. I think the big picture is, yes, I do believe that stem cells do work and they are the future of medicine. However, you have to really drill down and figure out exactly where the stem cells are coming from. So if it's stem cells out of a bottle, say the knee, if it's your own body stem cells, yeah, it's probably you got a chance. Yep.
I sure appreciate it, guys. I've
comfortable, get a second opinion, and nothing's wrong with that. All right, sometimes we just have to just do the show. Yeah, we're struggling mightily here, trying to get the sound to work, and I apologize because it's disrupting the flow of the show. But what we'll do is, when someone calls, we'll just summarize the question. I will have to listen to it because someone might just be hopping on. We'll just describe the question real quick before we answer. But to go back to the veterinary medicine and the genetic stuff, fascinating. I think it's awesome. We were joking when it first came up because I was like, how are you talking about veterinarian orthopedic surgeons? But what I love about it and what I love about you, Doc, is that you push the envelope. You got to ask different questions in this field. And it's not until you start asking questions like that, like, is there a genetic component? Things that people have not considered yet is when breakthroughs start happening. And so you have to think outside of the box. And the fact that you think outside of the box in orthopedics and sports medicine from a different angle, a different view, if you don't do that, and it's not just with orthopedics or ACL, in medicine, if we don't start asking questions that are coming from a different angle outside the box, thinking about something different, we won't be able to find things that will be new ways of treating things. So I think that's awesome. I appreciate the fact that you recognize that. I've always liked to look at the big picture, and you guys know that we work together on a daily basis. I'm clearly a big picture kind of guy. One of the other things that I learned, and yes, even at 62, after 31 years of practice, you learn things. One of the things that I have learned in this process of putting together this talk that Meyer made me do is the global nature of the same exact problem. So I wasn't kidding when I said I looked at 22,000 different articles. But it's a global perspective. Now that we have the internet, it's a global perspective. They're doing studies in South Africa. They're doing similar studies in Germany. They're doing studies in Scandinavia where every citizen in Sweden who has an ACL injury is registered in their ACL registry. Every citizen. So we know about that. So let me finish. The point is, there are pockets of research all over the world. And if you are at sea level and you're just looking to see what they're doing in Cleveland or what they're doing in Memphis, you miss 90% of what's going on in the rest of the world. We used to think, we being the Medical Society of America, we used to think that we were it. We knew it all. Okay? Guess what? They caught up with us. Yeah. Everybody else has caught up with us. And I don't think we're number one anymore. But I don't know who is, but but the thing is, Dr. Brown, I apologize. What I like is the fact that crazy about it is, we've gotten really good at repairing ACLs. We've gotten good at knee replacements, hip replacements. I mean, we are so much better at this and have really found how to fix it, right? And it's almost like, well, we could say, oh, that's good. We got to move on to the next thing because we've done so good. But it's not until you, again, ask the question, hey, how can we get better? What is going on? Can we zoom out and figure what's going on? Is when you start figuring out things that you may have initially ignored because you did so well in something. Does that make sense? It makes perfect sense. In fact, you just stole one of my slides in my talk. In that we have made tremendous progress on ACL diagnosis, on ACL surgery, on ACL rehabilitation, on ACL braces. We have solved the problem. Exactly. And it might make you say, it's time to move on to something else. And people have moved on to something else. Right. But here's the question that we have not answered. We've not done a lick of work on prevention. Yeah. Prevention. 2 million ACLs a year You're responsible for AB. 855. I got to apologize to a lot of folks on Facebook. AB, I think I'm going to replace him like a Bluetooth speaker. I don't know. I'm trying to get the caller on. I can't figure it out. Why don't we go back to the old-fashioned electronic? We all have to mute the mic. Yeah. But I don't know. I'm going to not mess with it going forward. If you're on Facebook, let us know. What I did going forward is working.
We'll figure it out.
855-787-1033. Inside Sports Medicine coming back. Broadcasting live from the UNPH Museum ESPN Radio Studio. ESPN 103.3. This is ESPN Radio 103.3 FM ESPN. The all-sports station that gives you ESPN insider info on the Cowboys and the NFL. And look, if Don's looking at it, if you don't hope you've got a bounce.
Their mic on.
Good morning, I'm Todd Houston with a Sports Center update. The Dallas Stars have moved the Blues to the brink of elimination after a 2-1 win in Game 5 yesterday. In Game 6 will be played tomorrow in Dallas. The puck drop at 2 o'clock. Yesterday also the Hurricanes beat the Islanders 5-2 in between the teams. In NBA playoff action yesterday, the Bucks beat the Celtics 123-116 to take a 2-1 lead in the series. The Trailblazers stopped the Nuggets in 4 overtimes, 140-137. Nikola Jokic had 33 points in 65 minutes played. Stephen McCollum had 41 points, 8 rebounds, and 4 assists in the win. And in the NBA playoff action today, the Warriors will be in their take on the Rockets. Rockets scored up 3-0. That game starts at 7:30. You can hear it right here on 103.3 FM ESPN. I'm Todd Houston, your host for the bigger team in the big team, 103.3 FM ESPN, and KFN 103.3.com. Sex drive in the tank, but we can turn this back into yeah, you just need a tune up. We bring that in. You're wrong.
20 is leading the charge in helping adults every step of the way. This summer, we're launching a 6-week summer transition experience for ages 16 plus, focusing on vocational opportunities and adaptive workforce, like wakeboarding, paddleboarding, taking away. Year-round programming then begins in the fall. 49 new books last in your community to help get scholarships by donating $5 per month. Let's take a look at the cost of small business.
Okay, well, I'll just cut the mics. I'll cut the mics off, and I'll just leave that on. Now they should hear us just fine on that, because I just cut the ESPN feed off.
Don't roll the dice.
So
Bet
again,
on
it goes back to the
like I
initial
said,
thing.
you know the number.
They can't. We're gonna sort out. This goes back to the initial thing.
Online.
We can run it off
Check
this,
out.
off that mic. But what we have to do is put the mute.
I'm in favor of that.
That's the only way to do it.
For the next hour, let's just do that.
Because now
Let's just do that.
Now the gain is dropped way low on the Mevo one, so that means the audio on that is better. And now that I cut the feed from ESPN off,
Let's do that. Let's do it that way.
Yeah, Renee said the sound on Facebook Live is horrible. We're hearing the commercials and modulated.
Yeah.
Can't understand anything.
We're fixing it.
Okay, what about
we're
now?
about to fix
See
it.
it out at historic Cedar Crest Golf Course, home of the 1927
Every
PGA
line is full.
Championship won
Holy
by
crap.
Walter Hagen,
Okay,
designed
what about
by
now?
A.W. Tillinghast,
Ask them
and
now
centrally
that I
located
switched
near
this.
downtown, with great views
Because
of
I
the Dallas
cut
skyline.
the mics. The game.
She said it's great now.
Yeah, the
She
game.
said it's great.
Yeah, the game looks good on my end.
Dude, I don't want to experiment anymore. We've got another hour of the show to do. We've got 5 phones that are lit up. So let's just on 1, 2, 3 turn off the mic when the people come on.
Live,
Okay?
life, and golf.
Okay.
Jam on Sports and stuff.
When you
Monday
say,
morning at 9.
Jeff,
Sean
go,
Taylor
we're all
and
gonna
Matt McLaren
Just give us a
on
head nod when you
ESPN
get to
Radio
read it.
103.3 FM
We'll just take that
ESPN.
cue.
Well, it's easy. I'm going to say, all right, we're going to the phones. Clay, what's up? And then we're going to do it.
On 103.3 FM ESPN with your host, Dr.
I'm gonna go to Clay first.
Orthopedic surgeon and medical director of Texas Sports Medicine and Orthopedic Group. Get your sports medicine questions ready and call 855-787-1033.
All right, my Facebook people.
Welcome back to Inside Sports Medicine. So I want to make sure that the 25,000 or 50,000 people who are listening to us on the radio are not completely offended by the experimentation that we're trying to do for the 2 people listening on Facebook.
Oh, come on.
No, the point of it is to be able to have this show in perpetuity. So if you're not up at 7 in the morning, you'd be able to come back and listen to George's call about his wife's knee replacement, and then being offered stem cells and what the story is on that, or other topics that we talk about. So we by next week should be a well-oiled machine.
So they always tell you not to apologize when you're giving a talk. Don't start off with an apology. But we're doctors. At the end of the day, we went to medical school, not electrical engineering school. So that being said, I think we have a solution for the next hour, which is perfect. The solution is for those of you listening on the radio, those of you listening online, and those of you listening and watching on Facebook. So I think we have a solution. We're going to keep it going. We have every single line lit up at the ESPN studio, which means lots of you have questions. So that is the cue that we're going to go to Clay. So Clay, good morning. What's up? Can't hear Clay.
You gotta put him on. He's not on.
All right, Clay. Yeah, now we can.
I usually feel when I first stand up, it's a real sharp pain. And it'll usually go away once I start walking. Some weeks I don't feel it, or sometimes I don't feel it for a couple weeks, and some weeks I'll feel it every time I stand up or when I'm walking upstairs. And I had an MRI about 8 months ago, and it showed a 2-millimeter tear on the articular cartilage of my femur on the inside of the knee, and 3 loose bodies. And my question is, the doctor recommended or suggested microfracture surgery, so that'd be a good candidate for you. I'm just wondering, when to know when a good time to have surgery is, and how effective some of the other procedures are, like PRP or stem cells.
All right, so that is a fantastic question, and I'm gonna lead off, and then I'm gonna hand the baton to Dr. Mayer. So let me define for all of those listening. There are 2 types of cartilage in the knee. There's the cartilage that covers the end of the bone. It's the white shiny stuff. If you've eaten a turkey leg at Scarborough Fair or a drumstick, this white articular cartilage is what prevents arthritis. And then there's meniscus cartilage, which is a pad. It's not unusual as we get older and age that this white, shiny articular cartilage degenerates, kind of turns yellow, and it starts to flake off, and next thing you know, the bone is exposed, and you hear old people talk bone on bone. Well, yeah, that's what happens when in 70, 80 years of being athletically active or just active in general. Sometimes that process starts off early in your life and often associated with some kind of athletic injury. But let me tell you, a 2 millimeter articular cartilage lesion is probably not your problem. 2 millimeters is less than 1/8 of an inch. Microfracture is a salvage procedure if there's a big area of exposed bone, okay? And if there's a big area of exposed bone, probably the size of a nickel, especially in a young person, you know, an 80-year-old who's bone on bone, we ain't gonna do microfracture. Too late, cow's out of the barn. But a 17-year-old with an area of exposed bone because he caught a helmet on the side of the knee, those are the people we're going to do a microfracture on, which is to tap into the bone marrow. So all that being said, I am not 100% sure that your 2 millimeter lesion or even the 3 small loose bodies, it sounds like the random sporadic going up and down stairs may simply be tendonitis. Dr. Mayer?
Yeah, so on this one, it honestly goes back to your symptoms. You know, we get this all the time in clinic where someone will read us their MRI and want us to then correlate the MRI to their actual problem or symptoms, and that's not how this thing works. It always has to start with your history and your physical. What are your true complaints? When does it bother you? What are the actual issues you're having? That is then just confirmed on what we see on the MRI. We don't let the MRI drive our train of thought.
Yep.
So with you having pain, look, a loose body is a mechanical problem. It's like a rock in your shoe. Are you getting locking? Are you getting catching? Do you feel something getting stuck at times? As you bend your knee, do you feel something jam up? If you're not having that kind of symptoms, it doesn't really matter with the loose body. I mean, people have these. Until they become symptomatic, then you just go in there with a knee scope and you take them out. I mean, it's a mechanical problem. PRP and stem cells or whatever, all those questions, that's not going to solve a loose body. A 2 millimeter little ding in your cartilage, that is negligible. That is something, I'm telling you, so many athletic people have that, and that's not something that you would have ever showed up to the office for. I can assure you that. So we just got to figure out, big picture, why are you really there? What is the initial, what's your really chief complaint, and what's your exam look like?
I'm going to leave you with this, Clay, because we have to move on. The phones are just going crazy. Unless you misunderstood, and I'm not going to throw your doctor under the bus, but unless you misunderstood, if your doctor is telling you you have a 2 millimeter lesion and he or she is already jumping to microfracture, you need to go somewhere else. All right. Thank you.
Again, nothing's wrong with a second opinion. I mean, that's just it. Nothing's wrong with a second opinion if you don't feel confident.
Well, but see, most patients don't know.
I get it.
Any better.
Okay? I know, I get it.
So some orthopedic somebody or other is saying, there you go, your MRI shows a 2 millimeter lesion, we got to do microfracture. I give Clay credit for calling.
I know, I get it, but he's calling because he's not confident, is what I'm saying. Something doesn't add up.
And the concern with microfractures, it's not the surgery, it's the rehab. And people, if you don't buy into microfracture rehab, you shouldn't even be getting.
And if you start going down that rabbit hole and it's not your issue anyway, that's the problem.
It's a mess.
Yeah, it's a mess.
And you really have to commit to that rehab part. I would never do a microfracture surgery on someone who is not committed to the type of rehab
or that you weren't absolutely sure that that's their problem.
Mayor, what was it that you said that Dr. Andrews said if you ever want to operate on a shoulder?
Just order an MRI.
Yeah, because there's going to be an abnormality. There's always going to be an abnormality, and unless you are, what's the word I'm looking for? Unless you are conscientious and diligent and ethical enough to match the diagnosis to the findings, you can operate on everybody that walks in the door.
I'm going to bring up the entire.
You can operate on my knee right now, Doc. I'm telling you.
I'm going to bring another field of medicine up that I think is. I kind of chatted with a lawyer about this. I have 4 expert witness cases going right now. 4.
All right.
And we were chatting about forensic orthopedic medicine.
What is that?
So, and maybe that's not even the right term to use, but are physicians who maybe are unscrupulous or whatever, unethical, working with lawyers, doing operations on patients that don't necessarily need operations, working with lawyers to ramp up legal claims and fees.
Happens all the time.
And so how do you work
sick.
backwards in terms of kind of like a forensic medicine backwards? Were those surgeries indicated? What were the reasonings? Where's the op report? What was said? Where are the actual photos? Where are the arthroscopic photos to work backwards? And that's coming up with an issue I'm working with right now. A young patient in their 30s from a two-step fall who went to multiple ligament reconstructions, who is now a candidate for a knee replacement.
You're making me sick.
At 30 something?
At 30 years old,
Because I'm about
right?
to go off.
You're making me
So
sick.
it's crazy, and that it just brings back to the point. Be very careful on when you get MRI reads, and we talk about this all the time. The radiologist doesn't know you; they've never met you. And especially if they're not ours in house, they're being sent a scan without ever talking to you. Don't know your symptoms. Never put hands on you. Did not do a physical exam, and are told to interpret an image, sometimes with literally no history.
Yep.
And they have to read everything that's on there from just an objective standpoint, whether it matters.
And they're
or
doing
it
their
doesn't.
job. But that's the thing, they're doing their job.
Their job is to describe what they're looking at.
It's the doctor who's sitting in front of you
Exactly.
who's also
So this
interpreting
happened
that
to
and
us.
seeing you as a patient.
This happened to us last week on the guy I operated on Friday. We had a patient who came in. The radiologist totally called a bunch of things in the knee, totally missed the diagnosis on the guy's meniscal tear. Never had a chance to examine him, so it's in a subtle area in the side of the knee, and he had what's called a radial tear in the meniscus. And I saw it. I had to call this radiologist and say, hey, look, I know you guys are busy. Maybe you didn't know. Let me just give you a little story on the guy. Do you think I'm concerned that lateral meniscus has a radial split? And I told him which coronal images I'm looking at. Oh yeah, I agree with you. I see it there. That's a real subtle call.
Now I see it.
That was the guy's reason for being in my clinic for the pain. That was a 15-minute operation, had a radial split, trimmed it out, nothing, move on down the road.
Yep.
All right, phone's going crazy. Let us go to Robbie. Hang on, let me.
That was our patient, by the way.
Yep.
Robbie?
No.
Oh,
another guy.
Oh, Robbie from Flower Mound. Good morning. What's up?
Appreciate you taking the call and very much so enjoy your show.
Thank you.
So, what I'm really looking for is, can you help guide me to who I should go see, whether it's a neck, back guy or orthopedic, sports medicine guy or who. So, what happens is I, predominantly at night, I get these stinging kind of numbing pains that start in the shoulder and go down to the tip of the fingers in both arms, and it's almost like it's asleep or I don't know, kind of hard to explain. Like you hit the elbow, you get that elbow stingers, but it's continuous. And then I get up at night, stand up, hold my arms down, kind of shake it out a little bit. It goes away, lay back down. It comes back again, sometimes 2 or 3 times a night. And it also occurs when I go riding my road bike. I don't know if it's because I'm in that position or I'm cramping my neck or whatever. So anyway, just looking for a little bit of advice if you guys could maybe point me.
Absolutely, Robbie.
Robbie, Dr. Mayer here.
Great question.
Yeah, so anytime, when you called initially, they said, hey, shoulder issues. But when you hear bilateral, when this is going down both sides, you got to go upstream first, and upstream's your neck. So that's where we're going to start. And so
neurologic.
And honestly, I think, you know what, our other partner, Manning, Dr. Manning would be absolutely perfect for this.
Yeah.
So an evaluation of a spine surgeon, or Dr. Manning's an interventional spine doc who's a physical medicine and a rehab doc, so not an initial spine surgeon, but somebody who does a lot of spine work, and that's usually where you start with. Most spine surgeons nowadays, you almost don't start with them, you almost get referred to them, but that's where you would start to at least just get a diagnosis. So figure out, all right, well, what level in your neck is this coming from? Dr. Manning would do all the initial stuff. He'd do the x-rays, get the MRIs, figure out what level is this bothering you, and that can be figured out just by a history and a physical exam. The nerves that exit, go ahead.
Because I never have any neck problems, and it used to be dominantly on the right side, never on the left side, and then maybe the last 6 months it started to kind of pop up on the left side also, and it's almost equal to both. So
Great question.
Yeah, great question. We get this all the time. And this happened in clinic with a guy, hey, I get pain radiating down my leg, and it's by my hip and my knee, and I'm telling him it's his back. And he's like, doc, but only my hip and knee hurt and down my leg. So the way these nerves come out, whether the neck or the low back, they have a very characteristic distribution of where they're going to go. So when you tell us, hey, it's more my little finger and ring finger, or doc, it's more my middle finger, maybe my thumb, we know characteristically what nerves tend to be in those areas. We can do motor testing, we can do reflex testing, we can do sensory testing, and that starts honing down in that area. Then, again, Dr. Manning would evaluate and look, hey, all right, are you a candidate for therapy? Are you a candidate for anti-inflammatories? Are you a candidate for certain targeted injections that need to be done, under fluoroscopic guidance? And then you start honing down. Once you get to that area, and then you can start talking about treatment pathways and start with the non-surgical stuff, and then you go from there. But that's where I would start. Seeing a shoulder specialist like me off the bat is just wasting you one additional clinic visit.
So Robbie.
Like all 5 fingers, the tingly stuff, and then I'm an avid weightlifter, and I go to the gym 6 days a week and do, I consider it, fairly high level intensity weight training, and it never bothers me when I'm lifting weights, which is that kind of perplexes me also. Is it? I mean, never. Yeah. So.
Well, so hang on. So this is. I want to summarize. I think we helped you. I think we helped you in that we provided you guidance. Your question is a question that we all get in the office every day, and that is, where is my pain coming from? Is it coming from my shoulder? Is it coming from my neck? And in your case, it clearly sounds like it's coming from upstream, as Dr. Mayer said, and that makes it neurologic, and therefore you probably need to have someone who is comfortable looking at your neck and spinal cord and nerves look at you. And PM&R is a very good way to start, neurosurgeon, orthopedic spine surgeon, that kind of thing. But don't let the fact that the word surgeon is in their title mean that this is necessarily surgical, because 90% of the time it can be treated non-surgically. Right. But I would go there, and I'm going to leave you with one last thought. It could be shoulder, and it could be neurologic. It's not unusual for patients to have both, that they overlap. But I think we got you covered. Now we're going to move on to the next one. Thanks.
Thanks, Robbie.
All right. When we come back, we're going to go to Mike or go to George. We'll flip a coin during the break. Inside Sports Medicine, 855-787-1033. The text machine is 21,000 21000. I don't want to get away from the question of the day, which we need to answer before. Yeah. Which sport do you think requires the most talent?
We're going to talk about it on Facebook.
We're going to talk about that, yeah. Text us your answer, 21,000, start off with the 4 letters ESPN, or call in your answer. Inside Sports Medicine, Suriel, Mayer, Ballard, coming right back.
So, can the people on Facebook hear us right now?
Yeah, right now they can,
yeah. So, 2 stories for the Facebook listeners. One is, I had a guy come in clinic, actually a friend, bilateral tingling, numbness, discomfort in the hand, went to a neurologist. The neurologist told him he had bilateral carpal tunnel. It could. Yeah. All right, bilateral carpal tunnel. I examined the guy, and his symptoms spare the thumb and the index finger. He's like, oh yeah, those feel fine. He's like, it's this stuff. They did an EMG, which
bilateral carpal tunnel, or was it further upstream?
Yep. So the neurologist kept telling him where the brace is, and he came to me saying, dude, the braces aren't working. So he was getting treatment for carpal tunnel the whole time. He's like, this guy's not listening to me. Like, I'm coming to you because something else is going on. Goes upstream, but it's the same thing we talked about. Like, whoever did the EMG did their job, right? But it's the neurologist's responsibility. Dude, he's got to be able to look and say, this is sparing the median nerve.
What the problem is, there's nothing written.
You know what I'm saying? And then the other one is, I had a guy come in yesterday, medial meniscus tear on the MRI, and I saw it. I mean, it was obvious.
Texas Sports
But I
Medicine.
talked to him. I said, "How you feeling?" He's like, "I don't have any issues." Like any issues. I said, "Well, I'll be honest. When I came in, before I came in, I thought I was going to be telling you one thing, but you're telling me you got nothing going on. There's no reason for me to." He's like, "I don't need PRP or anything." I was like, "Well, you may still have this medial meniscus tear from a year ago, but you don't need anything from me right now because you're doing great. You're doing squats.
Another guy I'll
You're
bring
doing
on
yoga."
Friday. On Friday. I don't think you sent me. 2016 playing basketball, felt he had an injury in his knee. And it all sounded meniscus from 2016 basketball. He's been since 2016 playing basketball.
Yeah.
With the same issue. And his exam sounded like it. I mean, I've seen the guy for a while now. He had a big old flap meniscal tear flapping in and out of the joint, but has been living with it.
Yes.
Just doing fine with it. And it just got to the point he was like, you know what? It's annoying. I got a little kid, now I'm running around with him, and I feel it when I get down on the ground. I'm ready to take care of it. Cartilage looked great, had no cartilage issues, nothing, just had one big flat posterior horn medial meniscus that would just
Going in and out.
completely loose.
Dude, I'm convinced.
Billy Frampton thinks of hockey.
I'm convinced.
He's just
Billy.
agreeing with you.
He is not agreeing with me. He probably didn't even hear
He
it.
may be,
I know I
he
got
may be saying hockey, but I swear to you, it's not because they know how to ice skate.
No, but hold on,
Maybe
man.
it's
I
the
know,
wrong-
whoa. You're writing that off, but that is, I mean, I will say, and it ain't because I don't know
Do you know
how
how many
to
kids
ice
up
skate.
north that ice skate and are good ice skaters?
To that degree, though, dude.
You are minimizing.
Look,
what
you gotta
these
at least
hockey players
respect
are
the
doing.
argument. I mean, the argument is.
I agree. But
They're doing 360s on one leg and hitting the ball as they're or the puck as they're falling into the upper corner. Are we on?
yeah, I agree. That part is good because a good ice skater to me is like a good ball handler in basketball. A guy that can 360 spin, that can go through the legs, that can spin and manage that.
You're saying basketball.
Yeah, basketball in a sense, because if you think talent-wise, there's a natural born talent. How many guys in the NBA are below 6 foot? You know, you have to win the lottery of birth just a little bit to potentially be a great basketball player.
Yeah, there's some.
You are not in baseball. Less lottery of birth. Golf,
Let's
less
take
lottery of birth.
Let's take 6'9" out of the equation. Do you think Larry Bird was a great athlete, or do you think he worked his ass off?
Great shooter.
Well,
he learned how to be a good.
You're
You're not born a great
to
shooter.
me, there's a different question between which one has natural talent and which one requires more skill.
More
Like, what's the
development of
question?
talent. Development
Is
of
which
talent
one
or
is the
born
most
with talent?
Which sport requires the most skill, or which one is like you need the most natural
And
talent?
that's what makes the question so great.
Oh, I see.
The question
More
is so
general.
great because how do you answer that?
Right.
Zion Williamson.
He's just
beast.
freak.
What do you say about that? LeBron. You know, what do you say about that? You know, what do you say about guys like that?
Well, but you're diminishing the fact that they work at it.
Right.
They do, but that's what do you do with a guy that's born? He's 6'10". You know,
that's why I'm saying is the question. You can really break it down. Is it which sport requires the most skill to be able to like do? You know what I'm saying? To perform, or is it which sport? You know, you just need to have natural talent. Like to me, we all know football. To me, football is the bottom of the barrel.
All right.
To me,
in terms of athleticism or talent,
athleticism is you got to take that out.
Yeah. Because it's hard to
gotta take out
Because think about
athleticism.
golf. Think about how
That's why
hard
I'm looking at golf.
gotta
I'm
be.
looking at golf.
I'm thinking golf has to be.
Golf is up there.
Golf is up there.
Because
dude.
you think about the leaderboard, how it kind of goes up and down, up.
Well, and to look at how these guys can place a ball, that is skill.
Sam Soriel, the answer to your question is golf.
I'm kind of with Sam. I'm with Sam.
Golf is up there. Because I'm a basketball fan and I think I'm pretty damn skilled at basketball. I want to say basketball to say that I'm skilled, but golf requires. Dude, you know when you break down a swing, you know how much stuff has to happen. That is a skill that you can, but you can practice it and get better at it. But it's a skill that you have to practice. Some guys are just good because they're athletic. But
What
some
about
guys
hitting a
are good
baseball
because they
95 miles per hour?
Exactly.
Hitting a 92 mile per
Because
hour
you can
slider or
practice a
something
skill,
like
but
that.
is there a natural thing that exists too?
ESPN.
Inside Sports Medicine with Dr. T.O. Sorial, orthopedic surgeon and medical director of Texas Sports Medicine and Orthopedic Group. Dr. Sorial's comments are meant for informational and educational purposes only, and and not as a treatment. His comments are not a substitute for a visit with your doctor. And now, Dr. Tio Sorial.
I think that was one of the funnest breaks we've ever had.
Yeah, I don't want to, make anyone who's just listening to I don't want to say just, but who's listening to the radio only, feel, out of the box or out of the picture. But the folks on Facebook just got some pretty good stuff.
So we were discussing amongst ourselves the question that we asked at the very top of the show, which is, which sport do you think requires the most talent? Now, we didn't break it down. We just left it as a general question that was thrown out there, and actually came from my wife, Karen. So this is, I give her credit. We were watching the hockey playoff, and she said something to the effect in passing. Get her sports medicine doctor, which sport do you think requires the most talent? And I said, that is a great question. I'm going to pose it to our listeners. And the three of us in the studio have three different answers. And we all have reasons why the other guy's wrong.
Anybody text?
And during the break, it was a heated discussion as to who believed what. Now, my opinion is that the answer to the question is hockey. Mayor's opinion, and I don't want to put words in your mouth, but he threw out golf. I think golf requires a heck of a lot of talent.
Yeah. I'm tossed. I don't know. Golf is definitely up there. Basketball. You look at some of the stuff that people can do with the basketball. I'm a fan of basketball. I think that's kind of, persuading what I'm saying too.
I'm going to try to answer it. I'm going to try to answer it a kind of a strange turnaround, Sorial selfish way. Okay, Sorial selfish way. I answer the question based on what I think I can or can't do. So, can I play tennis like Roger Federer? No, but I can play tennis. Can I play basketball like LeBron? No, but I can play basketball. Can I play golf like Tiger? No. See where I'm going here? Yeah, but can I play hockey like Gretzky? Hell no.
Because you just don't know how to skate,
and
that's the
because
reason.
You don't skate often. You know what? If you lived in the north, in the Northeast, it might be a completely different answer because you're just exposed to hockey more.
I just said I'm answering it the way I would
Look,
answer.
I grew up near 5th Ward, Houston. We didn't have no ice, so I don't know how to.
You did have ice, but it was on people's teeth, right?
Exactly. Wait, we had ice grills, but we did. But I wasn't exposed to it. Maybe it's just an exposure issue.
So someone else threw out gymnastics. I think gymnastics, absolutely. Gymnastics is up there, requiring kind of talent. What to do the Iron Cross, and now they've got different versions of the Iron Cross where you're horizontal. Oh my God, how does a human do that?
Some people are going to say hit a 95-mile-per-hour fastball.
No, I think that's legit. That's hand-eye coordination. That's huge.
That's absolutely legit. But again, requires talent. Can you be taught to hit a 95-mile-an-hour fastball? I don't know.
Yeah, I think you can. I think you can practice. I think you can practice a skill and get better. Obviously, right?
But then, okay, yeah, this is a great one.
Let's get to Mike and George.
Yeah.
Let's get to, which one do you want to do first?
Go Mike, I guess.
Yeah.
All right, let's go Mike. Hey, good morning. You're on Inside Sports Medicine. What?
Yes, sir, I'm here. I had both my hips replaced before I was 52. And I played lots of tennis. I worked on concrete most of my working years. And but when my first hip went out, they had to give me radiation after my surgery on both of my hips. They did a radiation thing on both of them because I built bone on bone, and I want to know what you thought about that. And I'm starting to feel it kind of build up.
All right, Mike, I'll take this question. This is a topic I actually discuss in clinic quite regularly because I do a lot of elbow surgery. For whatever reason, the body at the elbow and the hip tend to form something called heterotopic ossification, also known as HO. There you go. That's what he told me. There you go.
It makes bone where it shouldn't make bone.
So we don't know why those two areas of the body tend to predominate. And after a hip or an elbow surgery, even minimal surgeries, when I do elbow arthroscopy, that means putting little cameras, tiny poke holes into the elbow. This can happen. And radiation is a known way to treat this. And it's usually done immediately after a surgery. They send you over to the place.
The hospital, but yeah.
Okay, exactly, and so that's the concerning part. So we don't have a great answer. There are medications I actually place patients on after I do elbow surgery for this exact reason. Radiation is probably the most aggressive, maybe gold standard, if you want to call it that, for trying to prevent this. But docs don't have a great answer for this, and sometimes the treatment for this after a hip surgery is you'll get the hip replacement, things will be kind of going well, then all of a sudden you're getting real stiff, you can't move, you're starting to get some pain, the doc gets an x-ray, and you're seeing this bone form kind of all in the soft tissues, not even like in the area of the joint, but just kind of around the area just where the operation occurred. And so they'll have to go in there and excise it, cut everything out to try and help. So it's really a tough problem to manage. Mike, I don't know if I have just a great solution, and this is something that honestly keeps me up at night every time I do an elbow surgery, because nobody walks in with a sign on their forehead saying, I'm going to be the one that's going to form HO.
All right, let's go to George from Irving. What? No, George?
Your mic is
Your mic's on. You got to turn your mic on.
Oh, hey.
Awesome.
Yeah, we're going to have to figure out a way around that.
Yeah.
Okay, so that was good. Let's go to George from Irving. Yeah, hello?
Go ahead.
What you got?
Yes, my name's George from Irving. And first of all, I want to say that all the reason I'm calling your show right there, because you guys is awesome. I've seen you guys like every week, Saturday and Sunday. And you guys gave me the courage to call your show, because the reason why, because you guys dumb it down for people like myself. And I know there's other folks out there that's not as smart as you guys are, but you guys make it so easy and so simple. And I truly love that. I truly love that, because I'm from a small country down from Louisiana right there. So in our country town right there, when you're a doctor, you God, okay? Because they believe any and everything the doctors say. Having said that, fast forward, since I was so listening to you guys here, okay, I had surgery September 23rd. This September here will be 2 years. You guys have educated me more than my doctor have told me. I know more about my body. I know more about my surgery now, listening to you guys, than my doctor. Because you go in there, and I'm actually a dummy, okay, and I have a meniscus. And my meniscus was cleaned out right there. And a year and a half later, right now, I can't tell is this the same problem. I can't. Every year, I'm 53 years old. Every year on my birthday, I would play basketball with my sons. I can't do that. I can't bowl. And I'm thinking just a meniscus. There's got to be something else. I mean, my life cannot be over because it's just a meniscus. And I went to a doctor that I wasn't educated on. It could be me. I wasn't smart enough to ask the questions. But you guys giving me questions and everything that I should ask. I want to know, how can I go forward? How can I, at times right now that I cannot go downstairs without turning sideways. I can't go upstairs without favoring my left knee. And I had surgery on this knee right here. Sometimes it don't hurt. Sometimes it's very painful, like I never had surgery. And your meniscus, it can't be like my life is over because my knee hurts.
Well, George, first of all, thank you for the compliment.
That's why we do what we do.
We are terribly flattered. I don't like to use the term we dumb it down. We just use different words to explain it. And communication skills are very difficult in the medical world because those who go to medical school are usually science-based people, and communication is just not emphasized. It's really quite amazing that the 5 of us at Texas Sports Medicine all share that same gift, and I call it a gift, that we are able to explain things to our patients in a way that they can understand it. What you hear on Saturday morning is exactly the way we explain it to our patients the rest of the week. And it is not dumbing it down. It is using everyday language to describe a meniscus, which is a cushion. It's using everyday language to describe, a ligament which functions like a rubber band. And doctors in general either don't have that skill or don't take the time to learn that skill. I am very flattered to hear what you had to say. Now let's go back to your meniscus question. It rarely is someone of a certain age diagnosed with just a meniscus, because most of the time when you get to a certain age, not only do you have a meniscus tear, but you also have mileage on that knee. And if you focus all of your attention on treating the meniscus tear, but don't focus any attention to treating the arthritis that's brewing right below the surface, then you miss it. Then you get residual symptoms. I always tell my patients over 50, this is a standard line in my pre-op visit. Look, you've got a torn meniscus. We're going to go in after the torn meniscus, but you also have a 50-year-old knee, which has mileage on it, which I can't reverse. So therefore, even after we treat your meniscus, you're going to have some residual symptoms. I think I can make you better than you are now, but I'm not sure that I can make you 18 again. This is what I say in clinic every day of the week. And to answer your question, yes, you probably had a torn meniscus, but no, that's probably not all you had. And someone is not paying attention to the rest of your symptoms. What do I think it is, just based on what you told me? Probably arthritis. That's what I'm guessing.
But perspective is everything, right? If you're walking out of that surgery or any procedure thinking, oh man, this is the cure-all, and no one really set the groundwork of the framework of how things are supposed to move forward, well then, any pain that you have, you're going to think like, this didn't work.
Yeah, George, I usually leave patients when I see this issue. I usually tell them, look, if your pain is worth $1, I don't know if your meniscus is worth 20 cents and that little cartilage issue is 80 cents or vice versa. Are you getting 80 cents of your pain is coming out of that meniscus tear and only 20 cents of the arthritis? But if you don't acknowledge both, you're really wasting your time and the patient's time, because doing an arthroscopy may not even be honestly a necessary surgery, and sometimes it's a waste of healthcare dollars. And you got to really start thinking of focusing attention elsewhere in terms of the arthritis. What injectable options? What activity modifications? What type of anti-inflammatories are you on? What activities do you like to do and not like to do? What things can we limit, etc.? That's really a better way to manage it than to do a knee scope, clean it out, and 3 to 6 months later, you're like, wait a minute, what happened? I feel the same exact problem.
I will say that if you were a 20-year-old and you had a torn meniscus from playing soccer, we don't have that discussion about arthritis, because using Dr. Mayer's analogy, 95 cents out of that dollar is coming from that torn meniscus, and maybe 5 cents is from something else. Thank you so much. Appreciate it,
Hey, George, real quick, you like crawfish?
I'm turkey, chicken, fish guy,
All right, cool.
All right, thanks, George. Appreciate it. Keep listening.
Because you don't know if the fastball coming, you don't know if the slider coming, you don't know if the curveball coming. And it is so difficult to hit a ball that's moving. The golf balls don't move, it stands still. The basketball, you can make a layup, you just gotta be bad. Football, you just need to be strong, but it gotta be baseball, I believe.
George, you're a smart guy, man. I really like the way you think.
Wow.
Thanks, buddy. All right, quick little break. Inside Sports Medicine. T.O. Sorial coming right back.
Join Dennis and Cal Shaw this Tuesday at the grand opening.
I like George. George is cool.
George is cool. He's got a
meniscus. 50% off of your next new vehicle. That's this Tuesday from 3 p.m. until 6 p.m.
No balls,
at B&M
no
Leasing.
bats, no clubs. Just the wrestler and his talent.
Read that. You got to read that.
Sports Radio Habit.
No balls, no clubs.
No balls, no clubs, no bats.
I got curling. I was about to say, there's no way curling.
I'm the proud aunt of a championship high school wrestler.
say? Like, you guys come in.
So
you got like the match.
we need to do curling. We need to.
I can do curling.
No, I'm not saying curling, but remember we were talking about we need to get. We were gonna get a curling team.
Texas Sports Medicine curling team.
You were here when we were talking about the curling team.
There's no
Yeah,
way.
there's got. I know this is ridiculous.
Tee it up at
And can you
historic
imagine all
Seacrest
four of
Golf
us?
Course.
No, we're not gonna have it.
The
curling team?
No, I'm talking about the
Walter
button
Hagen,
thing.
Oh,
designed by A.W.
Can I talk to the engineer guy?
centrally located near
talk to him.
downtown
Give me his
with
name.
great
Or
views
I'll
of
probably
the
here.
Dallas
We'll talk to him on the way out.
Practice on
Oh, really?
natural
He's always here
grass
Saturday
tees at the driving range and short game area. Cedar Crest is a
Can we
big
actually
time
get him in
golf
here
course
now?
at a
Because this would be
small-time
worthwhile.
price. Play this classic gem for less than $50. Play golf.
Yes.
Play Cedar Crest. Visit golfcedarcrest.com. Cedar Crest Golf Course.
We need.
Live,
I think it'd be
life,
hilarious if
and
we
golf.
put a curling team together.
When it comes to matches in the DFW, 29 acres
Dude, they have a
legal
curling
charge
league
coverage
like
every
Frisco,
step
man.
of the way.
They
This
got a
summer,
curling
they're launching a
league.
6-week summer
have
transition
leagues.
experience for ages 16 plus.
Dude, I'm
focusing on
fascinated by
vocational
curling.
opportunities in
I'm
adaptive
too.
lake sports
I'm
like
fascinated by
wakeboarding,
curling.
When it's
and
on,
more.
I want
Year-round
to be the sweeper.
programming then
If
begins.
we
That's what
form
we
a
were
team,
talking about.
who's
Remember,
gonna be
who's
the
gonna be the
sweeper?
scrubber? Who's gonna be the tosser?
Who's gonna be
You
the
want us to
tosser?
be the
I'll toss
tosser.
it.
That's only
He-
one
he-
cup
he
of
thinks
coffee,
he can-
people. Donations
Oh,
can be
you're gonna
made
get
at
hurt then.
29acres.org.
I'm gonna get back up.
I'm gonna
I'm
say.
just gonna stay down the whole time.
I'll scrub.
I'll do it on my stomach.
We can scrub.
Me and Ballard the scrub.
Because ain't nobody who else is gonna scrub.
And
Ain't
then
nobody else
you
gonna
and
scrub.
Blue and Dog got to alternate because one of y'all gonna get hurt, one of y'all gotta sit out. One push, one push.
So have you ever heard of
Against drunk driving. MAD for short.
I know.
Mothers who know what to do. Call 877-MAD-HELP
I know,
and
they
that's
couldn't
what
hear
you
the call.
get. Help. Help at no charge, of course. Of course.
Yeah.
Learn more about
I
how
don't
we
know how
help
long the
victims
league
of
is,
drunk
but if it's on
driving next time you
weekends,
visit.
like, I think
Mothers
we might be
always
able to
love
pull
a
that off.
visit at mad.org.
It's Inside Sports
I'm just
Medicine.
saying,
Sunday and
how
Tuesday
cool would that be?
each
We
Saturday.
get jerseys.
Your
I'd love it.
host, Dr. T.O.
We're
Soriano,
at. Get a
orthopedic
curling
surgeon
team?
and
We're at.
medical
I mean,
Texas
dude, you
Sports
see, yeah, we got
Medicine.
curling
Inside
team.
Sports Medicine
Where
on
Mel and Rick
103.3 FM
They probably don't.
They don't.
ESPN.
Prescription products require an online physician consultation and are only available if the physician determines a prescription.
We get sponsors.
Oh, look at that golf ball. Look at that. How do you hit that? There's no way to hit that.
Actually, you can. You can move all that stuff out of the way, right? If you don't touch the golf ball.
I don't know the rules.
Are you allowed to move that?
I don't know the rules.
Guys, do you crescendo too soon? Now, thanks to
It's
4hims.com,
I
you don't
can't
have to.
watch that.
4hims offers
gracious.
options to help prolong intimacy. And when you go to 4hims.com/work,
UFC is
you
on.
get
If
started for
anybody's trying
just
to figure out
$10.
what we're talking
Consult
about.
with a
But
doctor
there's also
about
golf
treatments
on the
that
other
can help
station.
draw out those special moments and can be sent right to your door. Explosive openings have their place, but with 4hims.com, the bedroom doesn't have to be one of them. To get started for just $10, you need to go to this exclusive address, 4hims.com/work. That's 4hims.com/work to get your
who the
first
Texans
month
get
for
in
just
the
$10.
draft, you know?
FORHIMS.com/WORK.
They got some corners.
Monday morning at 9.
Uh,
It's ESPN's brand new show, Jam Session, with Shot Taylor and Matt McLaren
Oh, yeah,
on
yeah, yeah, yeah,
103.3 FM ESPN.
Who knows, man?
I love this song.
You're trying to figure out when to jump in, aren't you?
Yeah.
But you got to wait for the.
Now we jump in.
I told you I flew to Houston about 4 years ago to watch him at concert.
No, you didn't.
Oh, Axl Rose. I mean, he must have gained 100 pounds.
Oh gosh.
Yeah, he most of the band together. He played for 3 hours. 3 hours.
That's a workout, dude.
He
That's
took
a
a
workout.
10-minute intermission. It was great. It was an awesome show.
Welcome back to Inside Sports Medicine. Sorial, Mayor Ballard, live in the studio. We've been playing around with this Facebook thing for the last couple of weeks. And we've had a lot of really good calls today. We tossed out a question at the beginning of the show, and the text machine has exploded, which is, the question was, which sport do you think requires the most talent? And it's a generic question. Didn't say anything about athletic talent, didn't say anything about hard work. Which sport do you think requires the most talent? And we just had a response via text, curling, which started a conversation amongst the three of us talking about curling. So during the Winter Olympics, I was absolutely glued to curling. And curling is essentially shuffleboard on ice. I mean, I don't know. Did you guys ever play shuffleboard in a bar?
Yeah.
Okay.
Yeah.
So it's shuffleboard on ice. To use the Sorial analogy of a tough sport is one that I don't think I can do. The flip side of that, I can do curling. I can curl.
I'm telling you.
I'm pretty sure I can curl.
Well,
I
it's
think
a team sport, so you need to say which part of curling that you can do.
I can throw the rock.
Yeah, we'll see.
I can throw the rock.
Call it the rock.
Because you
Don't they call it the rock?
Look,
the
how about
stone.
this?
I think
How
it's
about
the
this
stone.
text that
We
we
had
got?
someone
How about
answer.
this argument that I got here on text? What the best sport is?
Oh yeah.
Oh please.
Oh, this an aunt. She wrote, "It's got to be wrestling. There's no balls. There's no bats. There's no clubs. It's just the wrestler and his talent."
But you know wrestling
laugh.
is skilled. It's a skill.
We laugh. That may be
that.
She's onto something.
I mean, that's hand-to-hand combat, basically.
Yeah, but it is a skill. Wrestling is a skill.
It's definitely a skill.
It's a developed skill.
Yeah.
Yeah. I don't know. I don't think that you're born a wrestler.
No. But again, I'm not of the opinion that there's not a skill that you can develop. I mean, over time. Now, some are just gifted, like meant to do this. You know, like a Tiger Woods or a Michael Jordan, right? I mean, but most skills, I mean, you can learn.
Somebody said track and field, and that would be the one I would probably least agree with.
That's pure athleticism.
Yeah, because if you look at just, we're sports medicine docs, if you have a really high proportion of type 2A muscle fibers, you are extraordinarily more gifted than the next guy who has a bunch of slow muscle fibers.
You're blessed.
You're blessed with quick twitch muscle fibers. You are going to be explosive. I mean, that is something like genetically, I'm not sure I'd say that is the most talent. That may be the most God-given talent. You know, Usain Bolt, if you did a muscle biopsy of him and you compared it to any one of us in the room, he's going to have a bunch of quick-twitch muscle fibers. Yeah, he's going to have a different type of muscle fiber. That may be another talk one day to give.
Yeah.
On the different types of muscle fibers patients have in their bodies and what helps in different sports. Endurance sports versus explosive speed sports, etc.
And look, not to diminish anything that Bolt does. I mean, I'm sure he works hard at his craft. But as you said earlier, Dr. Mayer, he won the birth lottery. Yeah. In that he probably has the right mix of muscle fibers, but also his frame. His stride versus my stride is 2 to 1.
So he broke the mold, and this is what I absolutely love about sports. When people break the mold of something typical of how they every runner has been a certain height. Typically, they've always said if you're tall, you're not really going to be able to be fast. And he broke every single mold of that. Not only broke it, but crushed it as a tall runner.
Do either one of you guys know? Because I don't know the answer to this. I remember a long time ago. This was before my time when they were talking about breaking the 4-minute mile.
It's one of my absolute favorite stories.
Breaking the 4-minute mile. Where are they now?
So there's a great story.
Is it a 3-minute mile?
No, there's a great, and I don't know if it's off a TED Talk, but the science. Yeah. The science of the 4-minute mile, and is it as impressive as what it used to be? Was it Sir Banter or something?
People thought you would die if you ran less than.
So they talked about the muscle, the training nowadays. They talked about the shoe wear, the coefficient of friction, all the different things that occur, and how the track surfaces have changed. And is running a 4-minute mile the same as it used to be when they ran it on a dirt surface?
What is it now?
The lowest time for a mile? I don't know.
I don't know what the lowest time is, but the fact that there's so many people now that run sub 4 minutes.
That's norm.
That just dropped.
That's
I
mean, when someone comes along and literally completely changes the way a sport is done or seen, like there's a commercial right now for Steph Curry because they're like the guy responsible for ruining basketball. Because most people you don't pull up for a 3 on on fast break, but he's got big men shooting 3s now because of the way he plays. Like when you break the mold with the way you do something, oh man, I absolutely love that because it was all built on a belief, and somebody comes and changes it, and then it changes the whole way things are done.
Or in the NBA playoffs, you watch a drive, it's an open layup, and they kick it out to the 3.
I
and
know.
you're like, wow, the game has changed.
That's right.
Well, speaking of, we only have a minute and a half left in episode 696. 4 overtimes last night. Imagine how these guys must be exhausted. This is where the trainers now earn their keep in the recovery. Yeah. The recovery, you're going to see which team bounces back better based on the recovery techniques that these trainers have been incorporating all year long. All right, I'm not a fan of the Rockets, but you both of you.
We might have to get together tonight, man, and watch this game.
I got my Rocket shirt.
Yeah, look, H-Town, we got to represent, man. So go Rockets tonight.
On behalf of all of us here on Inside Sports Medicine, don't forget you can see us at Texas Sports Medicine. Just Google Texas Sports Medicine. We should be the first to come up. You can ask us questions via email. We respond quickly, although I did get a question last week and I responded and it kicked back, so that's on your end, not mine. And the podcasts. You can download the podcast. You can watch the show over again on Facebook Live. Or
Inside Sports Medicine is what you just need to follow. Inside Sports Medicine, and all the shows will be kind of pulled up there. And then on the podcast, you can search by segment.
On behalf of all of us here on ESPN 103.3 and Inside Sports Medicine, until next week.
All right.
Out.
I'll be better next time.
I thought it was a good show. It was a little bit distracting.
We'll figure out the audio.
Yeah.